Thank you so much, Bonsai Betty D. Well, it is Monday, and that means it's time to ask a specialist. We're chatting with Dr. Gary Dela Cruz, staff pediatrician from the Queens Medical Center, about the human papilloma virus and a vaccine that's recommended for young adults. Hi, doctor. Nice to see you.
Good morning.
So first off, tell us what HPV is and how you can get it.
Okay, so HPV stands for human papilloma virus. Human papilloma virus is the most common sexually transmitted virus in the United States. The CDC estimates that 20 million people are currently infected and 6 million people get infected every year.
And a lot of people don't even know that they have it, right?
Well, HPV, for the most part, is asymptomatic, meaning no symptoms. But see, HPV can cause cervical cancer, and that's the problem we face right now.
All right, and can men get it?
Yes, men can get HPV just as much as women can.
What are some of the effects if men get it?
Well,
because obviously they can't get cervical cancer.
Right. Well, it's going to be a little graphic, but they could get genital warts or
other problems.
Other areas as well.
If you want more information, consult your doctor.
Yes.
And so, ultimately we're talking about getting a vaccine because there is an HPV vaccine, and they actually recommend it for young adults.
Yes.
And so what are the age ranges?
Well, it's approved for those between age 9 and 26 years old.
Okay. And so how do you recommend to adults to have their child get the vaccine?
So what we tell our parents is that it's not for now. It's to prevent future problems when they're much, much older. And so parents usually kind of understand that.
Yeah.
Well, we hope they do.
Is there a way to tell your child about what they're getting that you would recommend?
Well, from our point of view, we basically talk with their parents first. And as far as when trying to tell the girls what they're receiving, it's better to be just upfront and tell them what's going on.
Definitely.
Yeah.
And so what, are there any side effects from getting the vaccine?
There are. But the side effects aren't any different than side effects from other vaccines. Fever, pain, a little bit of soreness, numbness. It's been associated with fainting, actually. But you see, any medical procedure, any shot can cause fainting. So what we recommend is, after you receive the shot, sit down for like 15 minutes, just relax a little bit, and usually things will just go away.
Is this covered by medical insurance?
Yes, most insurances do cover, but there are certain rules as far as coverage is concerned, and it's best just to call your insurance company and find out what those rules are.
All right, so to summarize, obviously you would recommend this to parents, but
Yes.
what is the best way to tell them that it's important to get vaccinated?
Well, you see, if we can prevent cancer, and so far as this is the only vaccine that's specific for preventing a certain type of cancer, I think it's pretty important. 20, 30 years down the line, you would hope that your daughter doesn't get cervical cancer, and right now we can prevent it.
All right. Well, Dr. Dela Cruz, thank you so much for joining us and for giving us more information about the human papilloma virus. You don't hear very much about it.
No, not much.
All right. Well, thank you again. We are going to be back on Wake Up Today, and coming up, one of Hawaii's most visited sites.